Screen is not yet visible, ma'am.
Yeah. I need to share. Is it visible, sir? Is my screen visible?
Just a minute. Yes, ma'am. It is visible. Very good evening, one and all present here. I'm happy to welcome each one of you for our 372nd webinar session. The topic for today's webinar session is stress management for health professionals. It is going to be presented by Dr. Vaijayanti Mala Madam. She is the Head Department of Psychology, Madras School of Social Work, Chennai. I welcome today's speaker as well as the participant and core team members on behalf of the Department of Psychology, American College, Madurai, and Madras School of Social Work, Chennai, M.H. Chalamurthy Institute, Madurai, Red Pond Education Psychological Research Center, Madurai, and Yellow Pond Counseling Center, Madurai. I welcome wholeheartedly each one of you for today's webinar session. Ma'am, I'm happy to have you here. Now I request our core team member, Mr. Deevan, to introduce the speaker to the audience over here. Over to you, Mr. Deevan.
Thank you, sir. And a formal welcome to Dr. Vaijayanti Mala. Dr. Vaijayanti Mala has completed her PhD in psychology in the year 2007. She had done her MSc psychology. And what's interesting is that from 2013 till date, she has been working as an assistant professor in Madras School of Social Work. She has attended a lot of workshops and conferences, and her publications are actually quite fascinating because they include topics such as body cathexis in relation to personality and self-concept among college students. Another interesting topic is relationship between personality and social anxiety among college students. So among all of these wonderful publications that she has done, she has come here today to take a topic on stress management for health professionals. So over to you, madam, and we look forward to a wonderful session. Thank you.
Thank you, Deepan, for your introduction. And first of all, I thank the organizers for giving me this wonderful opportunity. Especially thank you, Suresh sir, and also my colleague, Dr. Srishti. So they have been really, she has been very supportive.
Ma'am, voice is very feeble, ma'am.
Now, sir, is it clear?
Now it is fine, ma'am. Now it is good.
Okay. So coming to this topic, right, stress management for health professionals. So we are all aware that stress is inevitable for all the professionals, especially for all the individuals, right? Nobody say that I'm immune to stress or I never faced a stressful situation. Okay. So this particular topic deals with stress management strategies. I'm going to talk about the overall strategies. There are three approaches for stress management. So introduction of all the three approaches, especially in the perspective of health professionals. Okay, coming to definition of stress, I think all of us are aware stress is a physiological and physical behavioral response by an individual when they perceive lack of equilibrium between the demands placed upon them and their ability to meet those demands, which over a period of time leads to ill health. In simple words, we can say if the demands of an individual exceeds the available resources, then the situation will be stressful for the individual. Okay, this is an definition for stress management. Stress. Okay. So, do you think stress always gives a negative effect? Stress always has a negative effect? Definitely no. So, in one way, we can say stress is a friend because it protects us from various situations. It gives us an alarm for an individual to protect themselves from various changes in the situation. And also, a minimal amount of stress is required for an individual to develop. Right? If an individual is never felt in stressful situation, if the individual has not at all is stress about a situation, I think there will not be any kind of development. So a minimal amount of stress is required for an individual to develop and grow. Okay, so coming to the types of stress, right? Stress is broadly classified into acute and chronic stress. So coming to acute stress, it is a short duration stress. It comes without any signal or without any expectation. It's a momentary stress. Okay, but it doesn't last too long, right? But at the same time, it needs a response. Okay, it needs a response from an individual, and also it will shakes the equilibrium. It will shake the individual's regular routine. Okay, so coming to chronic stress is a stress which occurs in a regular basis. Okay, and this will lead to a lot of physical and physiological illness if it is not managed properly. Okay, which can lead to a lot of health issues like cardiovascular diseases and also anxiety and depression if it is not managed properly. That is why managing chronic stress is very important for an individual to avoid all those negative consequences of the stress. Of course, managing chronic stress needs a lot of something like a short-term management technique and also long-term stress management techniques. Okay, so coming to signs of stress or symptoms of stress, there are a lot of symptoms and signs of stress of an individual when an individual is facing a stressful situation. Okay, so it is not the same for each and every individual because everyone reacts to the stressful situation in a different way. If, for example, if exam stress or test anxiety, okay, so each and every student will react in a different way. Some people they will get drained. Some people they will get a headache. Some people they will feel nausea or giddiness. Some people they will overeat. So each and every individual reacts in a different way for the same stressor. Stressor is nothing but a source of stress. Okay, coming to signs of stress, right? So I'm going to talk about the general signs of stress, which is most common. Okay, there are other signs as well. So coming to the sign now, feeling overwhelmed or constantly worried, becoming easily irritated or angry, feeling tired often. They always feel tired and they are unable to concentrate on any activity and losing interest in activities that they used to enjoy. Right? Some people they will avoid going outside, they will avoid talking to their friends or whatever the hobbies they used to do. They lose interest on all those activities. And also the physical effect, like physiological and physical problems like headache, body pains. So some kind of physical problems they used to face. Gaining or losing weight. Some people they will overeat and gain weight. Some people they avoid eating and lose weight. These are the few signs of stress. But of course, there are other signs of stress as well. And as I told you, repetitive exposure of the stress will lead to lot of long lasting physiological and physical health issues, right? Such as cardiovascular disease, diabetes, anxiety, and depression. Okay. So coming to health professionals, who are health professionals and what are they do? So health professionals, what they maintain health in the living through the through the application of the principles and procedures of evidence-based medicine and healing. Okay, whatever they have learned, it's a profession, right? Whatever they have learned, it can be like a medical or the caring procedure. They apply all those procedures for in maintaining the health of an individual of the individual. Okay, so what do they do? So health professionals study, diagnose, treat, and prevent human illness, injury, and other physical and mental impairment in accordance with the needs of the population basis. Okay, they will study the illness of an individual, diagnose, treat, as well as prevention. So it can be like physical or mental impairments, whatever their profession, it can be like physician, psychologist, psychiatrist, or even paramedical professionals, nurses. Okay, whatever the population they are serving, they will do all these things. Okay, so coming to this perspective of health professions, right? What are the common causes of stress among them? Okay. So first common cause is excessive workload. Okay, we have been seeing, for example, this last year during this pandemic. So health professionals face a lot of stressful situation, right? There are a lot of YouTube videos and also there are also news about the stress among these health professionals. So sometimes they are overloaded, right? Their work will be overloaded. They used to do number of working hours and the number of patients will be increased. So this excessive workload will lead to will cause stress among the health professionals and also working hours. So as the number of cases grows or the number of whatever the pandemic or any unexpected situation, health issues crops, the number of hours will increase in the among the health professionals. So this is one of the another cause of the another cause of stress among them. And the third one is dealing with death and dying. As we are all aware that these people deal with people with illness, sometimes what happens, we cannot say all the treatment will succeed because of some kind of nature of illness and all those things. They have to deal with all those death and dying of the patients. And patient expectation, this is very crucial, right? So what happens, right? A patient comes to a doctor or, for example, a psychologist, expecting the instant relief. Sometimes their expectation is if I go to a health professional or doctor, I need to be relieved immediately. Sometimes it is not possible. So they have to, as I discussed in the health professional introduction, right? They have to analyze, diagnose, and also treat. So it's a systematic procedure. So they have it has the time has to be the time is needed for them to all these things. So if the patient expectation is an unrealistic, so they have to these people has to deal with this patient expectation as well. So this is one of the source of stress for a health professional and also threat of malpractice. This is also one of the important cause for the stress. Okay. So coming to stress management, what is stress management? Stress management is a set of techniques and programs intended to help people deal more effectively with stress in their lives by analyzing the specific stressors and taking positive actions to minimize their effects. So what happens in stress management programs and techniques, right? So these programs will help the people, will help the individual to analyze, that is to identify the stressor. So what is the exact cause of stress? What is the exact cause of my situation? So and also analyze makes them to analyze, teaches them to analyze the stressor and also making them to take positive actions, that is dealing with stressful situation what that result in minimizing the effect of stress, whatever the physical or physiological or psychological consequences of stress. Okay, so coming to the stress management techniques, right? So stress management techniques are classified based on the reactions to the stress, how the individual react to the stressful situation. So here there are three major groups, that is action-oriented approaches, emotion-oriented approaches, and acceptance-oriented approaches. In action-oriented approaches, right? So these approaches are used to take action to change the stressful situation. In this approach, the individual directly faces the stressful situation and changes the situation as such. Okay, so in emotion-oriented approaches, these approaches are used to change the way the individual perceives the stressful situation. it doesn't changes the situation, right? It will change the perception of the individual about the stressful situation. And acceptance oriented approach. These particular approaches are used for dealing with stressful situation, which the individual is not simple. The individual has to accept. Say, for example, death in a family or death of a loved one. So these kind of stressful situation, so we cannot change. So only the acceptance is the solution. So acceptance oriented approaches deal with those situations, will be helpful in those situations. Okay. So coming to action oriented approaches, these are the action oriented approaches for stress management. So first one is delegating. So this delegating, right? We have been the individual has been facing with lot of activities that can be at work or that can be at home, right? So it is very difficult for them to focus their attention in all of the activities or all of the work and complete them on time. So delegating is one of the stress management strategy. So the individual has to delegate their allocated work. So it can be like delegating some of the work to their co-workers, or delegating some of the work to their subordinate if it is at workplace, or during at home, right? Delegating some of the activities to some of the work to the family members. So delegating tasks will help to complete the task on time and also reduce the stress of an individual. Okay. The second thing is setting boundaries. So everyone has a limitation that can be the limitation of the time, limitation of some resources, limitation of limit of the energy level. So each and every individual has to set up the personal boundaries to them. So what happens if we set our personal boundaries? It will prevent us from overexhaustion. Okay, so once the boundaries are set, right? So it is not only the setting boundaries and also it has to be communicated. So say for example, your working hours is 9 hours per day. That is a boundary. I can work up to 9 hours or 10 hours per day. So that is one of the boundaries, set boundaries for us. So it is not only important, but it has to be communicated. If the demand that is working more than 9 hours or 10 hours, right? We have to learn to say no. Okay, so that is also one of the action-oriented approach for stress management. The next is relaxing standard. Right, relaxing standard means we can't expect all the work in a perfect way. So we can't expect perfection in all the tasks which we are doing. Right? So we have to relax certain standards which will help us in reducing the stress. Next technique is time management, managing time. So which is very important. All of us know that we have 24 hours per day, 7 days per week. We cannot extend or we cannot prolong the day, right? 24 hours. We have to manage whatever the task within that 24 hours or within the 7 days of the week. So time management will definitely is a very effective way of managing stress. Many researchers they have shown that managing time will helps us to reducing the stress of an individual. So how to manage time? The first aspect is prioritizing. So we have to prioritize our work according to their importance, according to the time which is needed. Right? We have to allot more time to certain work which is very important. What is it? That procedure has to be inculcated. That is to identify which task needs how much time. Okay. So how to do all these things? That is one of the techniques is setting a realistic schedule. So I can finish this work within this time. So the time duration, the allotted time must be a realistic one. Okay. So and preparing a to-do list. Right. Tomorrow I have to do this work. Preparing a to-do list according to the priority. So it's not only allotting time for our allotting time for the workplace or allotting time for our work, right? So it is also equally important to allot time for our self-care. So allotting time for proper sleep, allotting time for taking food on time, and also allotting time for our relaxation, allotting time for spending with the family members and friends. So this is also equally important for an individual to manage stress. And next one is being assertive. So all of us know assertiveness is a very important aspect of communication. So if we are assertive, if we are able to clearly communicate, right? So that will help us to be more clear with our needs, right? We'll be able to communicate well what are our needs and what are our expectations and what are the things that bothers us. Alright. So if we are able to communicate all those things, it will become little bit easy for us to deal with stressful situations, provocative, proactive in a stressful situation. So what happens if we are non-assertive or if we are a passive individual, right? It can lead to feeling undervalued. It can lead to unfulfilled needs. So assertiveness is also one of the important aspects of stress management. So next is avoiding. There are certain tasks which can be avoided. So if we are able to identify and avoid those tasks, so that will easily reduce the stress. Say for example, if you are going for a shopping, if you are traveling, so you can schedule in non-peak hours where you don't, the time will be reduced and whatever the pollution and going in crowded places will be reduced. Certain simple tasks can be avoided. And the next thing is problem solving. So if we are unable to give immediate solution, right? Problem solving strategy will help in dealing with stressful situation. Right. So how to do this? What are the steps in problem solving? First thing is we have to describe the problem or as stressful situation. The problem means we are talking about the stressful situation. So we have to describe this particular situation in detail. What is that situation? What are the causes of that particular stressful situation? So that is the first step. The second step is we have to brainstorm the options, the available options. Just a minute. Am I audible now? Somebody said voice is low.
Audible, ma'am, but little feeble, ma'am, in between.
Okay. Now, sir. Okay. So the second step is brainstorming the options available to deal with the problem. Right? What are the possible options to solve that problem? That is the second step. A third step is executing the solution. Whatever the solution we have brainstormed, that has to be executed. That is the third step in problem solving. These are the action-oriented approaches for stress management, which deals with the problem or deals with the stressful situation directly and changes the stressful situation. So next aspect is emotion-oriented approaches. So in action-oriented approach, we deal with the situation directly. We change the situation, right? So here in emotion-oriented approach, instead of changing the situation, it will change the perception of the problematic situation. It will change the way the stressful situation is perceived by the individual. Okay. So first, emotion-oriented approach is reframing the situation. So instead of focusing on the negative aspect of the situation, right, the individual can focus the positive side of the situation. Say, for example, if a doctor has applied for a higher post or next post in an organization, right? So if he got selected, he is attending an interview. If he got selected, that is fine. If he is not selected, So that is a stressful situation. Instead of focusing that, okay, I am not selected, so the negative side, so we can change it in a positive side. That is, okay, this is one of the experience for me. I learned how to face an interview. So those kind of reframing the situation will help in will change the perception of a stressful situation. So, practicing cognitive restructuring. So, we all know that cognitive restructuring identifies the negative thoughts and also reconstructing them in a positive way, right? So, it involves whatever identifying the negative patterns, questioning those assumptions, and also making them into a positive thoughts. Okay, this will help in change the perception. So the next thing is developing positive affirmation, right? So positive affirmations or positive mantras like, so I can do that, I am capable of doing that, I will, I can. So all those things will help in changing the perception of this stressful situation. Okay, so the next thing is looking at the big picture. So what happens is sometimes we will overestimate the stressful situation. So that can be a small stressor. So but we perceive it as a big situation we cannot change or something like that. So we have to think whether it is that significant for us, whether it is that stressful for us. So is it matter that much to me? So we have to think whether it is because we are creating it as a big picture. So that will definitely help in reducing the stressful situation. Change the perception about the stressful situation. So next is acceptance oriented approach. So this particular approach helps in a situation where we cannot control. So we cannot change the control the situation. So like in action oriented approach, right, we change the situation. But here we have to accept the situation. The first first approach, first technique in acceptance oriented approach is mindfulness meditation and physical relaxation. So mindfulness meditation is nothing but being in the present moment and paying attention to the current or present thoughts and feelings and physical sensation and also accepting them. So this technique will help in acceptance of current situation of an individual. So next aspect is physical relaxation. Definitely if an individual faces a stressful situation which cannot be avoided, so there will be a lot of physical changes and physiological changes. This particular physical relaxation will help them to rebuilding or regaining their energy. Next thing is eating, the diet and exercise. Okay, so we must have a proper balanced diet, especially when we are in a stressful situation. So what happens, right? The stress hormones, right? Cortisol. So the stress hormone cortisol, so can cause sugar and fat cravings, right? So which leads to certain health issues. If you are having an excessive sugar and excessive fatty food, okay, which will have an ill effect or negative effect on your health, right? So keeping a balanced diet or eating a balanced diet, avoiding those sugars and fat will help to improve your health or will help to maintain your health, having a nutritious food or taking food on time. Okay, and also avoiding caffeine and alcohol will also help them in maintaining the health. Normally, when person is in stressful situation, so the immediate solution they will think is that taking alcohol, health compromising behaviors. Okay, having coffee, more coffee than whatever that is suggested or whatever that is required. Avoiding those two things will help them in maintaining the health of the individual. So next is exercise. Exercise definitely will help the individual to regenerate, right? Whatever the damage that has happened because of the unavoidable stressful situation. So exercise will help them to rebuild. Okay, and of course, sleep, definitely sleep is very important. We have to maintain a proper sleep hygiene, right, according to the age of an individual. If you are a child, if you are adolescent, or if you are older adult, they have to maintain the proper, the required amount of sleep. Okay, that can be 8 hours at night or 6 to 10 hours at night, whatever the sleep amount that is required, that has to be maintained according to the age. Next, talk it out. This particular strategy will definitely, it's not a solution, it's not a direct solution. So, but it will help you to break the stressful situation, right? So, if you are able to, if you are talking to your friend, or if you are talking to your your family members about the stressful situation, it will somehow make you to feel relaxed. All right. So, and if you are unable to talk to somebody, you can also write it, right? Even writing will reduce, to some extent, reduce the stress of an individual. All of us are aware social support, significant social support is one of the stress management strategy. And if even you can take the professional help if your the stress is in a higher direction. Okay, talking to health professional will help in reducing the stress. These are the acceptance-oriented approach for stressful situation, dealing with stressful situation. Now we'll see what are the tips for stress management. Okay, so in general, okay, first step is we have to identify the stress. So we have to understand the stress. So what exactly the stress for me? So that understanding is a basic step in managing the stress. So second step is we have to identify the sources of stress, that is a stressor. So what exactly causes stress for me? Is it this particular, for example, if you are facing an examination stress, right? We have to see whether what is my exactly source, whether I am not preparing enough, or whether the whatever the paper is tough, or whether the content is tight. We have to identify what is the source of the stress, what exactly the stress are. And third thing is we have to learn how to recognize the stress signals. Okay, stress signals means the reactions in the body. Right? We have to see what are the reactions. I already told you, right? No two individuals will react in the same thing. Each and every individual will react in a different way to the stressful situation. We have to learn how to recognize. We have to learn to recognize the stress signals in us. The next thing is recognize your stress strategy, that is stress management strategies. So which strategy will work for you? Say for example, some people, right, they manage stress or they relax by listening to music. Some people they will relax by going for a walk or doing exercise. So we have to identify which stress management strategy is helpful for me based on the nature of stress and also the stress signals or stress reaction in the individual. So next thing is implement whatever the strategies you have identified, you have to implement it. So that will help you in managing the stress. And so making self-care as a priority, definitely. So because whatever the time we are allotting to our work or professional development or professional responsibility, at the same time we have to allot enough time for caring yourself. That is what we saw in the previous slides, right? Allotting the time management. We have to allot time for our self-care, allotting time for spending time with family members, friends. So this making self-care as a priority. This must be priority, taking care of our health and physical and psychological health. Okay, so next thing is ask for a support when needed. So asking for a support is not a negative thing, right? Whenever we are unable to deal with a situation, right? So we can definitely ask for a support that can be with your family member or your friend, or a professional help. So these are the steps for stress management. Okay, just I came to the end of the presentation. Before that, I will leave with this quote. Stress is not what happens to us. It is our response to what happens. So it is just we saw, right, the emotion oriented approach. It is not the situation, it is the response to the our perception. And response is something we can choose. So it is our own reaction. We can choose how to respond to the stressful situation. Thank you very much. So that's the end of my presentation.
Dr. Chandra? Okay, Dr. Chandra. Dr. Chandra, are you there?
Can you hear me, sir?
Yes, Dr. Yes.
Thank you, Vaijayantimala ma'am, for a nice presentation. You have detailed very much about the approaches one can use in stress management, and also you have shared some tips for that. So now it's time for discussion. And now I request the participants to unmute your mics to discuss your thoughts with the resource person, or put your questions in the chat box. We'll take it forward. Thank you. Any comment or feedback is also most welcome.
Ma'am, can I begin with my inputs, ma'am, regarding our
Yes.
presentation?
Yes, sir.
Um, Actually, we had a session on stress management from different perspective, an action-oriented approach, emotion-oriented approach. These were the things we keep it in our mind for having that e-workshop. But you made those things in this presentation. I think you made everything in a precise, and at the end you given that what we need to take. That the points were very, very good. And another, what including me and my friends were here, they told me your voice is very feeble, ma'am. In
Okay,
between.
sorry. Okay.
Any suggestions from our side? This is my feedback.
Sure. I will share the slide. So sorry for the inconvenience. I will share my slide, sir. You can check it.
Please try once to talk without the headphone that you have used, ma'am, just to check if that was an issue.
Now, ma'am? Now I'm
Please, yeah, ma'am. No echo, no grains. Your voice is super.
Oh, sorry, we could have done this. Okay. So now this is the
I
stress.
tell you that, ma'am, but I just
Very clear.
next time, ma'am. No worries. Thank you.
Sure.
Thank you, sir. Your comment for today's session.
Good evening, sir, and good evening to all. Hello, am I audible?
Yes, sir.
Yes, sir. Please.
It was a wonderful presentation, sir. Especially the slides are it is more appealing to the eyes, and it's a very crisp and to the point presentation. Really thoroughly enjoyed it.
Thank you so much, sir.
Ma'am, I think you have made it clear whatever you have shared in this session today, and we don't have any questions regarding the presentation. But on behalf of the core team, mental health webinar series, and all the organizers, and also behalf of the participants, I thank you for the wonderful insights and also the time that you have invested for our session today, ma'am. And we have had many sessions on stress management, but I hope we also had new learnings in this session today. And what I feel about stress management personally is like we have to begin the first step in handling it after identifying what it is actually. We always feel stressful and we talk to people about it, but are we really working on the reason behind it is still a question, ma'am. So that would be the message that we will keep insisting in ourselves today and try to introspect much better and take it forward. So thank you for all the contribution that you have done today, ma'am. And also I thank all the participants who are traveling with us this far to make it more meaningful as always. Thank you very much. And see you all tomorrow in another session, the same link, same time. Until then, bye-bye. Good night.
Thank you. Thank you so much, sir, for this.
Thank you, Dr. Chandra.